The Oregon Health Authority tells me it's crucial medical marijuana growers report their cannabis products going into or out of their site or remaining on site, or else they'll be facing stiff penalties.
And there was no oversight for the last 18 years of the program. So now there's a lot of things being essentially shoved down the throats of the folks in the industry.
The Oregon Health Authority is reporting the vast majority of medical marijuana growers are out of compliance with Oregon state law. But for Brett Kenyon, who's been working with medical growers and patients for decades, it's not surprising.
OHA over the last 2 years has changed policy several times, sending out several conflicting pieces of information to the grow community.
OHA says 1,618 of the 1,903 registered growers didn't report their inventory as of February of this year, leaving just 285 following the law. The law applies to all medical growers except for patients who grow their own marijuana for themselves at their home and don't give it to anyone else.
We want to effectively and efficiently regulate the production, transfer, and testing of medical marijuana.
The OHA says growers are supposed to use the Oregon Medical Marijuana online system to upload data about their inventory and transfers so products don't go to the black market.
When that happens, then that's less of that product that is accessible to Oregon medical marijuana patients.
Kenyon agrees, but he says it's how the OHA is telling growers about the reporting system that's the real problem.
It's really been damaging to the medical side to have these conflicting information, which is why patients are suffering because they're not getting the growers that they need from a lot of these frustrations.
If growers don't get in compliance, the OHA says they face fines and could lose their grower card registration.
Growers are afraid to get into the regulated system.
Although Kenyon says he understands growers' frustrations with the system, he says it's not worth losing growers and marijuana for patients who need it.
So now is the time for growers and patients to make sure they're growers. If you have a grower, you need to make sure that your grower is participating correctly in the system, that they're registering, and so it doesn't put your license in jeopardy when it comes to your supply.
The Oregon Health Authority says they're sending warning letters out to growers later this month, and a grace period is being allowed before civil penalties are issued. In Medford, Amanda Rose, NBC5 News.